Okay, thank you so much. Good afternoon, colleagues, and welcome to this webinar. My name is Jack Abebe. I work with UN Women as a knowledge management and research specialist. My role in this webinar would be to facilitate the webinar, and I will do a quick round of introduction in terms of the events of the webinar. Is a 1.5 hour webinar focusing on the regional analysis on trends and emerging issues related to women with disabilities in East and Southern Africa. And the focus is primarily on COVID-19 pandemic. We will have a quick opening remarks by our Deputy Regional Director, Madam Zabib Kavuma, followed by a presentation of the findings and recommendations of the analysis of this study by Dr. George Kut. We will then have a discussant from a global perspective. Our colleague, Dr. Monjurul Kabir, has kindly joined to offer global perspectives of the same analysis. And Monjurul Kabir is the advisor for UN Coordination and Disability based at UN Women HQ. The second discussant is from a regional perspective is Roswitha Mudarikwa, who is the chairperson of Network of African Women with Disabilities. I have not seen her join, but I hope that she's joining as well. Then the third discussant, who will offer perspectives from a country context, and particularly focused on Uganda, is Rose Immaculate, who works with humanity and inclusion as a project manager for the WISH project in Uganda. Then we'll have a Q&A session for about 25 minutes, followed by a wrap-up, a summary, and closing remarks, which will also come from myself. So just to move us quickly, let us move into the first session of the opening remarks by our Deputy Regional Director, Madam Zabib. Karibu.
Can the host please allow me to project my video? Is that possible? If not, that's fine too.
No, it's possible. Evelyn.
Yeah, I'm not sure what needs to be done because it says you cannot start your video. Okay, maybe we leave it then.
Okay, I don't understand why it's not possible. I just stopped the screen sharing.
I don't think it, okay, perfect.
Okay, there we go. Okay.
Okay, thank you so much. Thank you, Evelyn. And thank you, Jack, for those introductions. Let me say a very good afternoon to you all, colleagues, ladies and gentlemen, who are all on this webinar. I think we have about 24 participants, so this is exciting, and we really look forward to very, very fruitful discussions. I also want to take this opportunity to welcome you all to this webinar that Jack had alluded to, which is the regional analysis on trends and emerging issues related to women with disabilities in East and Southern Africa, focusing, of course, on the COVID-19 pandemic. Now, this webinar brings varied stakeholders across the region together to dialogue and build consensus around the findings and also the recommendations based on the analysis, which is undertaken by our consultant, Dr. George Kut, who will also make his presentation shortly and will share the findings with us. This analysis will be then used to inform the actions and interventions that can ensure inclusivity of women with disability in the COVID-19 response and recovery frameworks, and also the plans of governments, as well as the plans of other relevant actors like the civil society, the media, academia, private sector, just to name a few. Now, by way of background, I would also like to say that UN Women takes cognizance of the fact that many countries in the region have ratified the UN Convention on the Rights of Persons with Disabilities and the corresponding optional protocol. Also, the African Charter on Human and People's Rights, and the Conventional Plan of Action of the African Decade of Persons with Disabilities. Several women's rights instruments also specifically mention the needs of women and girls with disabilities, including the General Recommendation 18 of the Convention on the Elimination of All Forms of Discrimination Against Women. Also, the Beijing Platform for Action and the Protocol of the African Charter on Human and People's Rights, on the rights of women, including the Regional Southern Africa Development Corporation, that's the SADC gender policy. The member states have since initiated measures to ensure that the embedded principles and rights are implemented. Now, despite this wider adoption of international, regional, as well as national instruments guaranteeing the rights of women and girls with disabilities, we still find significant gaps in the implementation and also the slowness with which some of these policies are being implemented at country level. For example, we know that information and data on women and girls with disabilities is limited in our region, that is the East and Southern Africa region. And as a result, their specific needs are not always addressed in the initiatives that promote gender equality and women's empowerment in the country. Of course, the situation has been worsened by the impact of the COVID-19 pandemic in Africa in totality, but also in our region, resulting in multiple discrimination and double jeopardy in the lives of women and girls with disabilities. Without wanting to preempt the presentation of the findings in the region, we know that the COVID-19 pandemic has exacerbated existing social vulnerabilities in society through economic hardship and stress that has further exposed women and girls with disabilities in our region to more forms of direct and structural violence occasioned by the lockdowns, social distancing, and confinement measures. Girls with disabilities are also victims of a triangle of factors based on age, disability, and gender, in addition to the multiple layers of negative cultural practices. However, the COVID-19 pandemic and experiences from responses and recovery have presented governments also with the opportunities for concrete and deliberate actions to reduce health inequalities, including accelerating the establishment of systems to ensure universal provision of quality services such as healthcare, education, sanitation, and also social protection. As I end, I want to stress that women with disabilities must be at the table and determine their needs during these difficult times of COVID-19 pandemic, and must not just be at the menu by different actors determining their fate in their absence. They must be actively involved in all spaces, including policy, investments, programs, and advocacy for inclusivity that guarantees their rights during this difficult time. So once again, I welcome you to this webinar, and I really do look forward to our conversation. We want it to be as interactive and inclusive as possible. So please jot down all your questions and comments that you have so that we can really engage and look forward to concrete actions that we can move forward with. So I hereby want to just officially open this webinar and welcome you once again, and thank you for your kind attention. Over to you, Jack.
Thank you so much, Madam Zabib, and thank you for echoing the need for women with disability to be at the table determining their needs as opposed to being at the menu without active participation. We then move to the next presenter. Dr. George Kut is the consultant who supported the UN Women with this analysis, and I welcome him to give us the presentation for the findings and key recommendations of the analysis of this particular study. Dr. George, please welcome.
Thank you so much, Jack. I propose that I share my screen with this presentation.
Please proceed.
Okay. I'm trying to share the, okay. Okay, welcome everyone to the presentation of findings of regional analysis. Now the presentation format that I will follow, I will look at the purpose of the study. Some photos are still interfering here a bit, just a bit. Okay, I'll look at methods shortly, data analysis, COVID-19 responses that will make the biggest part of the findings, then conclusions and recommendations. The purpose of the study was motivated by the fact that UN Women has a participation in the global UN partnership on the rights of persons with disabilities joint program on COVID-19. And the objectives were to undertake a regional analysis on trends and emerging issues related to women with disabilities focusing on COVID-19 pandemic. Also to document good practices on response and recovery efforts with regard to COVID-19 and women with disabilities. This study followed a documentary approach-based study using a framework analysis, and it examined the official government responses and recovery to COVID-19, the society and NGOs interventions on consequent implications of the pandemic. It focused on East and Southern Africa countries, Kenya, Uganda, Malawi, Rwanda, Tanzania, South Africa, South Sudan, Zimbabwe provided most cases in the study, right, that is mentioned in the report. The data analysis involved the identifying literature on disability, mainly from the internet, guidelines for disability inclusion during COVID-19. Such guidelines were drawn from those provided by ILO, UN Office of the High Commissioner for Human Rights, WHO, and these ones help to form the thematic framework for the analysis. Analysis of information relevant to women and girls with disabilities was then conducted based on that thematic framework. The analysis of trends and emerging issues focusing on extent of inclusion of girls, women with disabilities was the major part of the analysis. Now, the themes guiding the analysis were how women and girls with disabilities accessed information, how they accessed healthcare, education, finance support, and how they accessed protection of people living in residential areas in terms of response. And then reasonable accommodation for disabled persons was also looked at. Consideration of needs and disabled persons who face multiple exclusion, inclusion to decision-making process, that how much we are looking at how much the decision-making involve the women and girls with disabilities. And then the findings is say that as COVID-19 continues to have wide-ranging impacts in East and Southern regions, persons with disabilities are more likely to experience adverse socioeconomic outcomes, such as less education, poor health, as the Biba said, poor health outcomes, lower levels of employment, and higher poverty rates. Women and girls with disabilities have extremely been affected by the pandemic, as we found in the study. Including effect of direct and structural forms of violence against women and girls with disabilities, which has been presented in terms of heightened vulnerability to SGBV and GBV during COVID-19 pandemic. The prevalence rates for SGBV in the region are with high intimate partner violence being widespread. For example, in South Africa, they reported 87,000 cases of gender-based violence in 7 days of lockdown. While in Kenya, Kenya registered a significant spike in sexual offenses during lockdown. South Sudan, the 2019 GBV data study and presentation indicated that 54% of the reported incidents were perpetrated by intimate partners. Now, these rates may increase due to COVID-19 pandemic lockdown, confinements, and economic stress as we move on with the current wave. Access to healthcare services has been severely affected, and women and with disabilities are not able to access this healthcare, which is needed so much. There's loss of income and livelihood opportunities for women with disability, and higher susceptibility to COVID-19 infection. Also, we found out issues predisposing women and girls with disabilities to COVID-19 risks. Hand washing, occupation, as I will discuss shortly, the increasing inequality at the time. The basic need that many do not have in East and Southern Africa region, and access to soap and access to water in the home in the household constantly less likely to have access to soap and water. Yet in the demographic and health survey of 16 countries in sub-Saharan Africa, which happened before COVID, only 33.5% of households with an observed hand washing place at home have water and soap. Rural residents, majority of them forming the East African region, have a much lower access compared to their urban counterparts. In Burundi, Burundi had the lowest access in this regionally, showing 3.8% of rural residents and 1.7% of the poorest household having water and soap at home. So this tells us how hand washing, much as it remains a basic need, it is still not accessible to the poor, people in rural, and more likely to affect women and girls with disabilities in the process. Occupation directly impacts on abilities of women and girls with disabilities to protect themselves from infection through social distancing and covering face masks, because this was go with the cost, and costs that can only be addressed with very good occupation. Occupation also influences many other health determinants, including hand washing itself, with the pandemic forming employment and informal work opportunities for women. Burden has increased due to movements restrictions. COVID-19 is threatening to roll back the efforts in disability inclusion attained before. Access to health system also impact on health consequences. And this is great with disabilities. Staying at home has left persons with disabilities without access to health services, including needed specialized face-to-face therapeutic and medical care services. An example from Zimbabwe, a lady told me during the interview, part of the study, in Zimbabwe, we have options to call pastors, but we do not have personal doctors as the fee is expensive and we cannot afford due to lack of money. Options of visiting a doctor at a health center are nearly impossible. Such visits must also be within curfew hours. Some of us depend on personal assistants who have deserted us because we are said to be more susceptible to the COVID-19 disease. That was the remarks particular lady who was living with disability. Now, COVID-19 information on protection in most cases not provided in disability accessible formats.
Dr. George,
Negative.
Okay, proceed. I think we lost you at some point.
I'm being told here that my network was. Let me move a bit. Just hold on a second. Move a bit. Okay, Jack, is it better?
It is better. If you can please repeat that whole slide.
Yeah, I was looking at issues predisposing women and girls with disabilities to COVID-19 risks. Access to health system. I hope that is what I discussed last. Impact on health consequences are greater for persons with disabilities. Now, staying at home has left persons with disabilities without access to health services, including much needed specialized face-to-face therapeutic and medical care. In Zimbabwe, I mentioned about a female respondent living with disabilities who said, and I quote, "We have instructions to call personal doctors when sick, but we do not have personal doctors as their fee is expensive and we cannot afford due to lack of money. Options of visiting a doctor at health facility are next to impossible, as such visits must also be within curfew hours. Some of us depend on personal assistants who have deserted us because we are said to be more susceptible to COVID-19 disease. COVID-19 information on protection is in most cases provided in formats that are not disability accessible formats. Moving to negative social norms. Negative social norms affect women and girls with disabilities make violence acceptable, normal, and even glorified in some of our countries in East and Southern Africa. This determinants entrenched structural factors contributing to gender-based violence and acts of discrimination against women. Women with disabilities have pointed out the need to address the presence of cultural violence with roots running deep, tapping into beliefs, values, histories, and ideologies. COVID-19 response, focusing on women and girls with disabilities, must address these cultural determinants. Addressing social norms means highlighting cultural perceptions and stereotypes about women and girls with disabilities that make them more susceptible to COVID-19. We also found some issues around governance factors in COVID-19 response, that weak governance is increasingly being blamed for the discrepancies in COVID-related policy choices and health and socio-economic outcomes. Enforcement of some COVID-19 measures by security forces has been characterized by human rights violations in a number of East and Southern African countries. In Kenya, for example, social media users have expressed disappointments with the government for mismanaging funds allocated for COVID-19 response. There's public mistrust of governments, which may erode adherence to government enforced public health and social measures. Women with disabilities expressed concern during this study with government's delivery of public health and social measures because they don't feel connected with top leadership level where decisions on public health and social measures are made. We also found in the study that there are COVID-19 responses and recovery focusing on women and girls with disabilities in the region. and provides good examples. These are national examples that are spearheaded by government responses focusing on women and girls with disabilities. And again, examples of civil society responses targeting women and girls with disabilities. Now, in terms of national responses by governments mainly, there's financial support measures offered by government, namely the inclusion of persons with disabilities in extra cash transfers program in Kenya, Uganda, South Africa. In Uganda, the Ministry of Gender, Labor and Social Development fast-tracked disbursement cash to beneficiary bank accounts from national special grants for persons with disabilities. This was something that was anticipated to be done earlier, but was fast-tracked during the COVID-19, which was commendable. So support to education provision at home, Zimbabwe education sector strategy in preparedness and response COVID-19 recognizes different needs of girls and boys and the special needs of children with disabilities. There are also measures addressing special needs of women and girls with disabilities, like the National Union of Women with Disabilities of Uganda adapted its work plan to fit the climate of lockdowns by continuing to consult women and girls with disabilities through hotlines. In terms of humanitarian response, South Sudan Humanitarian Response Plan 2020 employed a COVID-19 adapted approach and to respond to the ongoing emergency to support government efforts in containing and preventing the spread of COVID-19. COVID-19 Relief Fund was also another measure. For example, in Botswana, the government established the COVID-19 Relief Fund and put up seed money into it, where individuals and private sectors are encouraged to contribute as part of their social responsibility. The other response, creating accessible COVID-19 resources. In Kenya and Uganda, for example, an organization called Light for the World created accessible resources available in local sign language and audio formats. Also made inclusive face masks, which has a clear, transparent rectangle patch in the center to enable lip reading for people who need to be supported. The organizations also had measures supporting women with disabilities, mitigate loss of livelihood. And Aga Khan Foundation in Uganda, in partnership with the Union of Women with Disabilities, provided cash relief to support the most critical needs. Light for the World, again, trained women with disabilities, mothers of children with disabilities, to make liquid soap and to increase their income that was lost during COVID-19. Civil society had also measures supporting technology to facilitate the fight against COVID-19. In South Africa, Africa Civic Tech has facilitated COVID-19 responses, which they have also done in other parts of East and Central Africa, to use technology for instant messaging, digital governance, and information dashboards. There's also inclusive education going on at home, like in Rwanda, Humanity and Inclusion has inclusive education team helping to promote access to school for children with disabilities by having school lessons broadcast on television, complete with sign language interpreters. In conclusion, the COVID-19 pandemic responses and recovery efforts in East and Southern Africa region are yet to see reasonable inclusivity of women and girls with disabilities. Also, intersectionality of vulnerability to COVID-19 pandemic is yet to be demonstrated as top of the response agenda in the region. Further exacerbating exclusion of women and girls with disabilities are cultural and structural determinants of health inequalities. The COVID-19 pandemic and experiences from responses and recovery have, however, presented governments with opportunities for actions to reduce health inequalities under, say, government and partners. COVID-19 responses advanced by governments, the private sector, and civil society showcase some attempts towards targeting women and girls with disabilities, either directly or indirectly. And I think if gender disaggregated data is provided, then the cases could even be more. Good examples of civil society responses include creating accessible COVID-19 measures, mitigating loss of livelihood, and supporting technology to facilitate the fight against COVID-19. The study recommends this way: ensure the availability of disaggregated data in terms of disability type and gender and age. Address negative social norms affecting women and girls with disabilities. Also, broadband internet should be declared, including hotlines, as essential services for domestic violence prevention. Also, adopt intersectionality analysis as a framework for understanding violence against women with disabilities, and especially during the COVID-19 pandemic. Making essential services accessible through multisectoral response is necessary, and supporting women with disabilities and caregivers of girls with disabilities to generate income will be very, very useful. Thank you, Jack.
Thank you so much, Dr. George. Thanks for presenting the findings and recommendations in a very summarized way. And we will, of course, share the report once it is finalized following this webinar with all colleagues. Let's then welcome Dr. Manjurol, who is our colleague based in HQ and in charge of an advisor with the UN Coordination on Disability, to give us certain perspectives from a global context, which then can marry into this analysis. Dr. Manjurol, welcome.
Thank you very much, Jack. I hope you can hear me well.
Yes, we can hear you well.
Thank you, and many congratulations to the regional office, and particularly Dr. Kut. You just mentioned some of the findings from your study, which is very, very important and critical. And I would say it doesn't stand out as a regional findings. It is very much findings from many other regions. So in a way, you are raising issues which are common to different regions. So you might say this is almost a snapshot of the global situation as well. Which brings me to the point, in next 7 to 10 minutes, I will spend on 3 things. One is where UN Women stands as an entity, which might be of less interest to many colleagues who are looking forward to more practical insights, as we just heard from the regional study. Secondly, what we are doing now, which is COVID-19, and I sometimes call that COVID-19 actually didn't create something new. It just highlighted the existing challenges that we all face, whether it is in health system, whether it is in the education sector, whether it is in governance. And the third is, I just would highlight some of the recommendation that Dr. Kut just mentioned, and how this recommendation can be leveraged for organizations like UN Women, for our important partners who are present today here, including organization of the person with disabilities, and also the partners who are not present today here, but we can continue to work with them. Now, as my colleague JB mentioned at the beginning, that there are, of course, a rich normative background for disability inclusion to be part of very robust global agenda, which is also in line with Secretary General's UN Disability Inclusion Strategy, where it is expected that United Nations will be much more inclusive and accessible to the population in the world by and large. And that has a background from UNPRPD, from CEDAW, you name it. All normative treaty bodies, recommendation from UPR, a recommendation from Special Procedure of the Human Rights, and many constitution of the world, of course. Now, UN Women came late to this discourse. I would call it late, but this is definitely something work in progress for many UN entities. We launched our global strategy on disability inclusion, focusing on, of course, women and girls in 2018, which was earlier than the UN strategy on disability inclusion strategy, which launched in June 2019. The reason I mentioned this to date, that position UN Women to influence the UN disability inclusion as well, so that there are elements of gender and intersectionality that this regional study captured can be covered and addressed by UN disability inclusion strategy, which is for every UN entities as they are operating now. Now, a strategy is only a strategy if it is really implemented. If it is not implemented, then the strategy doesn't have any value. So I think we are looking at how can we make it really relevant. So we have a global task team on disability inclusion and intersectionality to operationalize this strategy. But more importantly, how can we really connect with organization of persons with disabilities, with individuals with disabilities, so that it doesn't become a kind of remote ticking the box exercise for an entity or UN organization, number one. Number two, we can contribute to the solution, not become part of a problem. Because often you hear from the movement and OPDs and colleagues that we are tired of becoming a footnote in the discussion, where people will come to us, interview us, and discuss our problem, and then they will report back, and that is it. And I think we want to break this cycle of projecting the problem and want to become a part of the solution rather. And that's why I'm so interested and really delighted to hear the regional studies. And we are very pleased to partner with the regional studies and regional office on this, because this study also sheds light on some of the solutions that we need to see reflected in regional discourse, in our support to member states, and also cross-regional collaboration. What you are telling in this study is not unique and also has same resonance in Asia Pacific, have resonance in Europe and Central Asia, in Latin America and the Caribbean, in global North, and also global South, many other countries. They are grappling with the challenges of cultural context, the behavioral challenges. And it is not uncommon if you look at the whole discourse of violence against women, which in this report has quoted quite a bit. And one of the biggest challenges for us as an organization, UN Women and United Nations and many other partners who are present today, is how do you change the behavioral discourse in the society, which is really difficult. Enacting a law is only a part of it, but changing the decade-long or century-old behavioral pattern is much more challenging, and that applies equally to the problem when you try to solve in the inclusion and accessibility issues. Now, for UN Women, after the strategy, one ray of hope is that it is growing its prominence in terms of part of solution. Let me quote a quick figure to you. In 2019, which is the pre-COVID-19 year, right? And we are also keep a close eye on 2020, because 2020 really broke the many traditional understanding of how public health and governance work and interacted. In 2019, around 55 UN Women offices reported engagement with the work on women with disabilities, which is a sharp rise from 2018, the year we launched the strategy. So that means the strategy has an impact on the work of our UN Women offices and our partnership that are happening across the continents with organization of persons with disabilities. Now that is, and I also looked at what type of work we are doing in these 55 countries. And what came at the top of the list is providing normative guidance when government ask our opinion, integrated policy advice. When I'm mentioning integrated policy advice, let me give an example. When you are addressing women with disabilities in the context of ending violence against women, you are basically integrating these two challenges and look at a common solution. If you're dealing with shelter, essential services, look at how those also benefit women with disabilities. Operational support and capacity development, of course. Now, one of the other response to women, you'd be very pleased to know at the global level, we are now leading a joint program, which was attended by 9 UN organizations, UN, DESA, UNICEF, UNFPA, UNESCO, WHO, UN Women, of course, ILO. All these 9 organizations are joined together to develop a disability inclusive COVID-19 response. And it is funded by UNPRPD. UN Women is the lead entity, so we are coordinating the joint program. We are also coordinating another response, not related to COVID-19 particularly, but on intersectionality, developing an intersectionality global toolkit for enhanced UN support on the ground. And that we are also leading together with UNDP, UNICEF, UNFPA, and other entities. So 2 joint programs we are leading now. It is not about whether UN Women is doing more or less. It is also about how we are bringing all systems together so that whatever we are trying to address becomes a solution for everyone, not for UN Women alone. And that is critical for making sure that we sort of ensure the resource effectiveness and mobilization. I'll just focus on, for the interest of the time, Jack, I don't know how much time we have, maybe 2-3 minutes.
Yes,
so
you can go for 3 minutes. Proceed, please.
Sure. So I just want to look at one thing in terms of a future operational model for UN Women and for many partners who are present today is disability inclusion and accessibility issue. It has a price tag, and that is the uncomfortable truth. Sometimes we don't want to speak. We always want to be politically correct, and therefore we make right statement, we make the right noise. But I think we have to admit that before all of this, we have to make this part of our planning process. We have to make this our financial decision process. So the budget making process has to include and factor this one. And this is the same discourse we sort of engaged in when we are talking about pushing for gender equality in the late 90s, the human rights-based approach in the early years of this century, when the Secretary General at that time, Kofi Annan, was moving the human rights agenda for the system, moving the needle. All this discourse has a price tag. You have to factor that in your budget, whether you are an NGO, civil society, and UN entities or national governments. Many governments sometimes reach out to us at New York through Permanent Mission that what do we do, what we have to do to implement this inclusion agenda. And first thing I always said, can you please look at and discuss with the Ministry of Finance as well? And this is something very close to heart for UN Women, because we are very strong in terms of strong proponent for gender responsive budgeting. We face the same challenges. So I think there are many things that other agencies who are working on disability inclusion are learning from UN Women. And I think gender responsive budgeting is a critical learning point for us. Gender marker is an important learning point for us. And that's why now we are promoting at the global level a study on disability marker, looking at how the allocations decisions are being made on disability and how the expenditures are being tracked or not tracked. And we are very pleased to partner with other entities. We are talking to OECD DAC, we are talking to other bilateral partners on this, so that we can learn the lessons not only from the United Nations, but also from other development partners from the region and also outside the region. So it will be a global study as well. The last point I just want to highlight, some of the recommendations, Dr. Kut, you brought together through this study are extremely important. I already mentioned the behavioral change and cultural context is critical. Some of the solution that you indicated and the good practices that you found in your discussion with other partners are very, very important for economic empowerment aspect. But I just want to highlight 3 other recommendations which could be useful for us as a global organization as well. One is this intersectionality analysis, which is where we are going now, developing a joint toolkit, and we will be piloting this through UNCT in the field in April, May. So that is critical because many of our analysis lacks the intersectionality. We are now successful in analyzing from a gender perspective, from political perspective, but not on intersectionality terms, looking at multiple discrimination at the same time. Secondly, I of course fully agree with the suggestion on the multi-sectoral response. And particularly, I also like the idea of technology. You mentioned about broadband internet, which is important, because if you think about it, the internet is the window to many of the persons with disabilities to the world. And in the COVID-19 situation, that has become even more relevant and necessary. So we wish to push this through the Broadband Commission and through the member states, that how can the internet becomes not a luxury thing anymore. Of course, it is a part and parcel of the daily need, which connect persons with disabilities, women with disabilities to the medical services they need. The story that you mentioned about very expensive personal doctor and unavailability of health services is a story not only from that particular country in Africa, it is a story from Europe, it is the same story from Asia, it is the same story from Latin America. So the challenges for women with disabilities are global, and you will find resonance in every country on earth, no matter they are rich or poor, or at what level of human development they are in, which is very depressing, because if you think about it, a rich country, even if you look at the economic disparity against women with disabilities is very high. And the last point I would mention that you particularly mentioned support women with disabilities and caregivers of girls with disabilities to generate income. This is an important aspect of it, because often we always look at women with disabilities as a group or person with disabilities who will be dependent. And so therefore we look at from a charity perspective, which is what we want to avoid. We want to make much more productive discourse and see where economic empowerment can make a difference. In the same way, 30 years from now or during Beijing Declaration, women and economic empowerment was something which many thought that would be afterthought in many societies because they didn't see as a productive workforce for women. And we came across a long way and making women really part of and heart of economy. And we want to do somewhat similar, that how can the economic empowerment agenda become a robust agenda for women with disabilities facing pandemic or no pandemic, the regular challenges. So thank you so much for inviting me and for giving me opportunity, giving us opportunity to partner with you on this. I really congratulate the regional office for taking this effort. And I hope that you will continue the path to implement some of the recommendations that came out through this study. And you can count on our full support from headquarters to work with you so that we can do it better, learn better, and promote the cross-regional exchange in the true spirit of South-South collaboration as well. Thank you, Jack. Over to you.
Thank you so much, Dr. Manjarol, and we appreciate the global perspective, including some of the very critical initiatives that can accelerate progress towards inclusivity, particularly for women with disability, not only in this region, but globally, and also for emphasizing the need for implementation of the findings and recommendations of this study, which I am sure that our country officers will take as a priority and led by the regional office as well. Let me then welcome the next speaker, who is Rose Immaculate. Rose Immaculate is from Humanity and Inclusion. She's a project manager based in Uganda. and she'll give us perspective from a country context. Unfortunately, the speaker from Zimbabwe, who was to give us the regional context, has not been able to join. But just in case she's able to come forward by the time Rose finishes her presentation, then we will have that particular context. But Rose Immaculate, please welcome to share your perspectives.
Thank you very much, the chairperson of the discussion. I hope I'm audible enough.
Yes, you
Hello?
are. You are audible. We can hear you.
Yeah, okay. I'm going to present about humanity and inclusion. It may not necessarily be the three perspectives, but in relation to the discussion, just to give an introduction of what humanity and inclusion does in relation to persons with disability. Please allow me to share my small screen. It's not a very big presentation, but allow me to share my screen.
Please proceed.
So, is it visible?
Yes, but just put it on slide. Yes, good. It's visible. Proceed,
Yes.
please.
So I greet everybody that is in the meeting. Again, my name is Rosie Machuret Namugerwa, Program Manager for a project called Women's Integrated Reproductive Health Services. This project aims to persons with disability, though it is focusing the women. Persons with disability have access to reproductive health, but it is implemented in partnership with a consortium of other partners. But humanity and inclusion mainly is on capacity building and advocacy. First of all, I would like us to look at the definition of humanity. Humanity implies in our work is based on the values of human values, which includes everyone without exception. And we champion each individual's right to dignity, respect, benevolence, and humility. Those are the values that guide our work. Dignity, respect, benevolence, and humility. So we look at a person with disability as other persons. They are not exceptional. They are not very different, although they have special needs because of their status. And in terms of dignity, it means that actions aim to be inclusive of all people in need, in targeting the most vulnerable, sorry, not dignity, targeting the most vulnerable, including people with disability, and advocating for their rights. We use a rights approach to advocating for people with disability to access sexual reproductive health services. And the major focus is on accessibility, affordability, and acceptability. But at the core, respect, responsiveness, and providing complete service, comprehensive service is our core interest. Inclusion, we work alongside people with disability and vulnerable populations, taking action and bearing witness in order to respond to their essential needs, improving their living conditions, and promoting respect for their dignity. It is fundamental. Again, just a matter of emphasis. These are the fundamental values for our work. And this is a repeated something. Some of the interventions that we do, majorly we provide technical capacity building to the service providers of reproductive health services, especially those who are in partnership with the consortium partners for this project. We work with Reproductive Health Uganda, Marriage Stops Uganda, and Options, and IPPF and IRC. So we train the service providers so that they can be able to provide inclusive services, as earlier mentioned, with the qualities of the service. So we also do community sensitization for demand creation, and also have meetings with persons with disabilities, dialogue meetings, where we sensitize them and also try to reach to them and identify the challenges that they are faced in accessing the services. We conducted a barriers assessment and analysis, and currently we are disseminating the results in the districts where we work. We work in 3 districts. 2 of them are in a refugee setting and 1 in the development setting. So we work in Mbale and Arua and Yumbe. Arua and Yumbe in West Nile and Mbale in the Eastern. So in West Nile, we work with the refugee in the refugee setting. We also work to strengthen health unit management committees. These are the structures which are responsible for planning at the lowest unit and budgeting. So we work to strengthen them so that they can prioritize disability inclusion in the plans for sustainability purposes. We also work towards strengthening referral, because one of the challenges we found in our barriers assessment is referral. So we are trying to come up with a mechanism of referral for persons with disability so that they can be supported, so that they can know where they can access the particular services. We also work in partnerships and with partnership with other programs. And for example, during the COVID-19, when it had just come, we supported persons with disabilities and disability inclusion in the West Nile region, where we work in the districts of West Nile, so that the persons with disabilities can also have their voices heard. We also supported inclusion of persons with disabilities on the task forces for the COVID-19. This is a strengthening approach. We don't provide individual service, but as an institution, and in terms of accessing service, we expect them to access service. Lastly, we do advocacy for policy improvement. So we work with government departments and ministries to improve policy. So in terms of what has been presented, I think we in Uganda, given those activities that I've suggested, I have presented, and what we are planning to do in the future, I think we are very willing to partner with you, especially when it comes to capacity building, community sensitization, and advocacy in terms of policy improvement. Thank you very much. That's it.
Thank you so much, Madam Immaculate, and we appreciate what humanity and inclusion is doing in Uganda and other parts of the world, particularly on sexual and reproductive health, ensuring inclusivity even within the humanitarian setting for women with disability. And I appreciate also the intervention around creating referral pathways for persons with disability and ensuring that the attendant interventions can have impact in their lives as well. I think we will then move to a short Q&A. We have 20 minutes. And I want us to move to a short Q&A. If there are any questions, colleagues, feel to either type the questions or raise up your hand with the raise hand button, and we will enable you to be able to speak. If there's any questions that you want to clarify, please just feel free to raise up your hand. And Evelyn, please help me to identify and enable any colleagues who want to speak.
Okay, Jack. I believe there was a question from Lillian that was directed to Dr. George Kut. And on this one, she was asking the cases that he mentioned, are they specific to persons with disability, or are they overall GBV cases? So if Jack would like us to just take all the questions first and then respond, and then George can respond to this. So please direct. Thank you. Is there anyone else who would like to? Yes, I can see Rosweta's hand. Please.
Yeah, Rose is here. Rose was actually one of the speakers, and thank you so much, Rose, for joining. If you can share briefly, and also as you ask your question, but also share briefly the regional context. I will request you to share in under 5 minutes. Because we were just moving to question and answer session. Welcome, and apologies for coming late. Please proceed, Rose.
Thank you, moderator. I hope you are getting me. My battery is running low. We didn't have electricity the whole of today. So I just wanted to let you know that as Network of African Women with Disabilities, we have got structures all over Africa, but we are mainly into advocacy because we believe in demand-driven service provision. So as a network, we are always available to partner with people who work with women and girls with disabilities. So what I actually wanted to say is that now with the pandemic, the biggest challenge has been with most of our women and girls with disabilities that most of them are locked up with their abusers. So it is very difficult to access services or even to be able to make sure that the service providers are aware of your predicament. So I was just going to suggest that what we now need to do with our advocacy, we really need to re-strategize. And you know that if advocacy is to be done online, then you really need to do it in a different way. It is high time that we repackage our advocacy strategies, because all along we have been doing the face-to-face and you would do all your negotiations. But right now, I think it is important that we go back to the drawing board and make sure that our advocacy, you know, is packaged in such a way that it will bring out the desired results, even if it is not face-to-face, even if it is online. I think most of you who were presenting, you had slides and so forth. So I think for our women and girls with disabilities, we now need to train them how to make presentations using slides, or even how to package their individualized experiences, and how to package, maybe how even to come up with videos of what they want to share with partners, so that partners can get a better understanding of what they are facing. So I think with the pandemic, and we also need to continue consulting so that with our mitigation measures, they also our mitigation measures are inclusive and don't leave out women and girls with disabilities. And one of the reasons why maybe most of our women and girls with disabilities are exposed to gender-based violence, it is because of financial dependency. So we need to do something so that at least they are independent financially. So somebody earlier on spoke of income generating projects. I think it is very important that we come up with a strategy to address the
Res, I think we are losing Ross. Unfortunately, we have lost Rose. But I think the point that she has given on reimagining advocacy to ensure that advocacy is responsive to the needs of women with disability is a very critical point that we take home for this webinar. Let me come to Beatrice. I can see your hand is raised. If Evelyn, if you can enable Beatrice to speak.
Okay, I have enabled her.
Beatrice,
okay,
please.
thank you, Jack. Thank you, colleagues, for a very good presentation. I really like the discussion that is going on. For me, I think Rose has raised one of the issues that I wanted to talk about in terms of economic empowerment, especially given that people living with disabilities, especially women and girls, are really faced with a lot of challenges. But one of the key drivers is around their financial access and ability to be independent. So I think that's one of the areas that we need to look at. But I also did have a small kind of comment and an advocacy area. Given that a lot of governments are right now rolling out the vaccine, should we also not then advocate that people living with disabilities are actually among the priority, persons that would receive the COVID-19 vaccine? So maybe something to think through, or maybe it's already captured, but I thought that's one of the areas that we can include as an advocacy point. Over, and thank you.
Thank you so much. That's a very good point, Beatrice. And I think we will ensure that is included as part of the recommendations of this analysis to be taken up by different country officers in terms of implementing the findings and recommendations. Appreciated. Colleagues, I don't see any hands. Evelyn, I'm not sure whether there's any question in the chat that we have left.
No, just a question for George to respond to, but otherwise no other questions.
So maybe what we do now very quickly is to give every speaker just 1 minute to give their closing remarks, as probably they also respond to some of the issues that have been raised. And I will start with George, followed by Dr. Monjorol, and then we go to Immaculate. So George, please.
Yes, thank you very much, Jack, for guiding us through the discussions. It's been very useful listening to the responses from the presentation of the study.
You are breaking. You are breaking. Maybe you can switch off your video. You are breaking. Just switch off your video, please.
My internet decided to misbehave today. Doing a great day. Okay. Now, Lillian's question sought to ask, to find out whether the cases were specific to PWDs or general, persons with disabilities or general. Yeah, the study discerned the cases that were specific to women and girls with disabilities or persons with disabilities, even as much as most of the responses and recovery measures to COVID-19 were being done globally by governments, especially at the national level response. But there was a very, very important attempt by organizations of persons living with disabilities to translate some of these responses to what is specific to different disabilities. So this and if you're reading it more, then thank you, Jack.
Okay.
Over to you.
Even though you are breaking, but it's fine. Let's go to Dr. Manjurol in terms of any concluding remarks, please.
Thank you very much. The one point I would highlight, which we haven't covered today, but which is important for the region, particularly Africa continent, in addition to the other regions, is how do you ensure women with disabilities are present and remain engaged in a country which is in conflict, in post-conflict, or in challenging circumstances. And we are not seeing women with disabilities are part of the service delivery, part of the recipient of the services, and also the whole agenda of peace building, which is important agenda for the continent. And I think there we are also working with a number of stakeholders, with network like African Women with Disabilities Network, the colleagues just mentioned. And that is important because often in the midst of crisis, in conflict, in the issues of armed and conflict and war zone, women with disabilities are the last group people think of. And they are the one who are left alone without any support, without any provision of services or economic empowerment opportunities. So we would like to also raise the issue whether some of these recommendations and some of the good thinking can be translated into action points in the countries which are struggling with conflicts and where women with disabilities are not seen as part of the peace building agenda. Thank you very much. Over.
Yes, thank you so much. That's a very important perspective in terms of conflict and post-conflict situations, and how we can be able to support. And I hope that Dr. George, this is captured also in the final report to be able to track an agenda of implementation going forward. I see Rose is back. Rose, I will come to you, then I go to Immaculate. So if you can give your concluding remarks. I know you were cut short by your power. Welcome back. Please feel free to give your remarks as we close the webinar. Roswitha from Zimbabwe. Can you hear us? Okay, I think we can still not, she can still not hear us. So let's go to. Yes, Rose, please proceed if you can hear us.
Okay. Hello?
Yes.
Yes, I can hear you. I just wanted to say that can we make sure that women and girls with disabilities all over Africa, including those in humanitarian settings, they are part of all our activities. They are part of service provision, and then they are also part of those who are serviced. I think sometimes it's also important that they are also visible when we are planning, when we are implementing, and even as we evaluate. If we make sure that we have them all the way through from the beginning to the end, then I think we will do them a service. And then they won't remain in the margins. We will have brought them to the center. Thank you.
Yes. Thank you so much. That's a very important point on inclusivity. Let's then get concluding remarks from Rose Immaculate from Humanity and Inclusion, and then we come to Madam Zabib. Rose Immaculate, please proceed.
Thank you very much. Yeah, mine is just to emphasize the need for giving these women with disability information concerning their rights. Because if they don't know their rights, they will not be able to participate. We really need to emphasize the rights of persons with disability to sexual reproductive service. Any service, could be any service. If they don't know their rights, they may not participate genuinely. So that is my point of emphasis. Thank you so much.
Thank you so much, and thanks for emphasizing the point on inclusivity and access of that information, because the information also need to be disability friendly and responsive. Yes. Let's go to Madam Zabib for our Deputy Regional Director for any closing remarks. Zabib, please.
Thank you so much, Jack. I really just want to say thank you to everybody who shared their insights with us, and of course also to Dr. Kut for the analysis and the presentation of the findings, and also all the colleagues and participants who are here availed themselves. I think what I really appreciate is also this notion of needing to transform with the times, right? And really also empowering women and girls with disability to enable them participate in a proper manner. Now that we're utilizing technology in very different ways, and probably will never go back to the basics or the previous ways in which we were interacting, all the face-to-face. And there's a lot more outreach and connectivity that can be done now through technology, and really to embrace that also, and not treat that as a hindrance, but rather as an opportunity to engage further, even policymakers, government officials, development partners, and what have you, by just reaching out and using the technology to our advantage. So I think that is something that we have to take to heart, and empower and enable also those with disabilities to be able to do the same, right? And enjoy what technology brings, and the fruits of that to further the cause and the issues and address them differently. So I really appreciate that, and I think that's something we will take to heart. Yeah, so I think that's all I wanted to say, but just to thank everybody. And then I think, Jack, you will just say the final words. Over to you.
Yeah, thank you so much, Zabib, and thanks to all colleagues. We appreciate you taking time to participate in this webinar, and it is our hope that the findings and recommendations of this webinar, once we disseminate it, will be utilized for programming and policy responses, both at country level and also at the regional level. And I think one thing that has been mentioned by Rose from Zimbabwe in terms of putting women with a disability at the center of our programming, I think would be a very big achievement that we can bring out of this particular study. I just want to quickly appreciate again all the panelists who include our Deputy Regional Director, Zabib, Dr. Monjurol from HQ, and Rose Wita, and also Rose Immaculate for your time and participation, and Dr. George for presenting the findings and recommendations of this particular study. Quickly also to appreciate our colleague Evelyn Ongege, who has greatly supported the planning for this webinar, and colleagues even from ICT led by Joshua, who have really supported us also in this particular process. Also to appreciate our colleague Sylvia, who supported us gave us a lot of support in this particular process as well. And Dr. Sadiq, I know that you are part of the brains behind this analysis, and we also want to appreciate you. I think now the ball shifts to all the stakeholders who have participated in this event today, and other stakeholders who will also access this study to now prioritize how we are going to implement the findings and recommendations of this study. Once the study is revised, we will finalize it and avail it to all colleagues and different stakeholders. The recordings of this webinar will also be shared shortly, And we hope that you can help us to be ambassadors of putting women at the center of women with a disability at the center of programming and policy responses, especially at this difficult time of COVID-19 response and recovery efforts, and also ensuring that as the rollout for the vaccination begins, as has been mentioned by our colleague Beatrice, that they are at the center of that particular response mechanism as well. Thank you so much. And I think now we will close the webinar, and we really appreciate your participation. Thank you so much. Over.
Thank you.
Thank you.
Thank you. Bye.
Bye.